Given that we've been in lockdown since December 26th and more recently under a stay-at-home order, we certainly hope the numbers continue to trend downwards in terms of new infection rates. Dr. Dale Kalina, Medical Director of Infection and Prevention Control at Joseph Brant Hospital, comments on the effects of these social restrictions thus far.
Right, so the stay-at-home order hasn't been in place for quite long enough yet so that we'd be able to see the effects of that. But given that the lockdown, quote unquote, has been in effect since December 26th, we are starting to see some of those effects of that right now. But I think at the same time, we need to remember that we are not an island, right? So we are, Halton region itself is surrounded by all of the regions in the GTA, and we continue to support everybody in our region because we are one healthcare system and we are, one group of people who need to continue to care for one another. So although we're seeing a slight decrease in some of the numbers here in Halton, we still have very high hospital rates, not only here in Halton, but of course in the entire GTA. And it's important to know that we're continuing to develop those plans and continuing to reinforce those plans so that we can continue to provide the most care that we can to everybody in our community and to those communities that surround us as well.
As mentioned, Halton hospitals have been taking in patients from surrounding areas in the GTHA, and they're open to Niagara as well. Joseph Brant Hospital has space to take on these additional patients to help alleviate some of the surrounding hospitals due to their pandemic response unit.
The Pandemic Response Unit at Joseph Brant Hospital is our field hospital, which has been open for about 2 weeks at this time, and we have had patients in there consistently throughout that time period. So right now, we are certainly not overwhelmed in terms of the number of patients that we have in that, and we're continuing to be able to support patients both within the Pandemic Response Unit and within the rest of the hospital as well, not only to support Burlington, but also Halton and the rest of the communities in the GTA as well.
While some of the healthcare workers at Joseph Brant Hospital have already been vaccinated, the focus right now is still on vaccinating healthcare workers that are working in long-term care facilities, as well as the residents who live there. They're most vulnerable and at highest risk. Dr. Kalina now speaks to the safety and the efficacy of the Pfizer and Moderna vaccines.
So the vaccines that are approved in Canada do go through an independent verification process, not only for their efficacy, so how well they work, but also for their safety. So the vaccines themselves are long past that period where we're testing them out. We know that they're safe. We know that they work very well. And to look at a vaccine that has 95% efficacy is simply amazing. And the fact that we have that as a tool that we can use to help curb the spread of this virus is something that is exceptional. And I can't encourage people enough to get their vaccines.